Greetings, ladies and gentlemen. On today's occasion, we will be presenting our student project entitled The Role of IPE in Improving the Quality of Health Service. Before we start, please allow us to introduce ourselves, starting from our friend Nadira.
Thank you, Herberth. Hello, everyone. My name is Athiyah Nadira, and my student number is 220251160.
Hello, my name is Puruaswini Puruaswini Astawa. My name number is 2202511161.
Hello, my name is Yanti Graciella, and my name number is 22025111162.
Hello, my name is Evrilla Deidree Pangkahila. My name number is 2202511163.
Hello, my name is Putu Anjanika, and my name number is 22025111164.
Hello, my name is Adellya Pramesty, and my name number is 22025111165.
Hello, my name is Zulfikar Alauddin. My name number is 22025111166.
Hello, my name is Carolina Putri. My name number is 22025111167.
Hello, my name is Herberth Vernon Hartono, and my number is 22025111169.
Hello, my name is Cendrawan Han Santoso. My name number is 2025111170.
Hello, my name is Patricia Orlyn Jotan. My name number is 22025111171.
My name is Wildan Mahsyar. My name number is 22025111174.
And that's our introduction. And next, we will see the table of content of our student project. So here we will be covering about the introduction, aims, benefits, definitions, implementation of IPE in Indonesia, evaluation, improvements, and also the conclusion of our student project. Then the first one is the introduction part.
Okay, first I will explain the introduction. Health workers are required to develop good service for the community. However, the breadth of the knowledge about the medical world make health workers need extra effort to realize and provide full service. In addition, interpersonal communication between health workers is often forgotten. Distinct tasks in the field are frequently cases that are the produce overlapping and not coherently. Lack of the communication and interpersonal collaboration between health workers can certainly harm the patient. In addition, the delay of the flow of diagnosis and the provision of special treatment can also affect the outcome later. In Indonesia, the application of IPE is still relatively low. In survey, it was noted that the implementation of interpersonal collaboration in Indonesia reached 87% who had not implemented interpersonal collaboration well. Projection Sifa'ul 2021. Special education is training needed on the application of collaboration between the medical team to improve the quality of patient service. This collaborative practice needs to be taught to prospective health workers since they were sitting on the college students. And it's hoped that the future medical team candidates will be familiar with the sustainable work procedures. Next.
The aim of our student project is divided into two parts. The first part is general aims, which is to find out the important role of IPE for development of quality of health service in Indonesia. Then the second part is specific aims that consists of 4 aims, which is first one to find out the definition of IPE, then to find out the role of IPE in improving the quality of health service. The third one is evaluating the weakness and the strength of implementing IPE in health service in Indonesia. And the last one is to find out the things that need to be improved from the implementation of IPE in health service in Indonesia. Next.
And then there's the benefits of our student project. In the first side, in the theoretical side, is to provide a theoretical comprehension about the importance of implementing IPE, to add insight into the concept of IPE practice in Indonesia. Then the second side, on the practical side, first one is explaining the benefits of IPE for development of the quality of health service in Indonesia. And second one, contribute ideas in the form of things that need to be improved to increase the quality of health service. And the third one, provide an evaluation of the weakness and strength of the IPE implementation. Next.
Okay. The definition of the IPE itself. IPA or interprofessional education can be defined in multitude of ways. According to Illingworth, IPA is an education that prioritizes collaboration between individuals to improve performance, especially in health service. Meanwhile, according to Patsky, IPA is a collaboration between health experts that began when they were in formal health education. And according to World Health Organization, IPE means two or more students studying together in different disciplines to achieve effective collaboration in practice.
Based on those expert statements, we can conclude that IPE is a collaboration between two or more health professionals with different disciplines studying together. The improvement of healthcare service considered to be supported through the application of IPE because IPE is able to positively influence the attitude and perception between health workers, especially in the effectiveness of clinical decision making and the quality of healthcare. Next.
IPE implementation in Indonesia. The implementation of IPE in Indonesia is still minimal, especially in universities. The main thing that affects this condition is that the public's perception and understanding of IPE is still not open. In general, people still think that the mind health workers are identical to the medical profession, such as doctors. However, a doctor will always cooperate with other health workers. This is where students must begin to realize that IPE is an important thing to be applied and implemented, because students are the future generation of the nation's successor.
Some IPE-based learning methods that has been applied in Indonesia are: first, classical lecture. It is implemented by involving lecturers from different knowledge discipline and students from various health professions. Second, tutorial lecture or problem-based learning are done by small group discussion that involve students from various health professions to discuss, identify, and find solutions to solve the problem that are being discussed. Third, laboratory skill learning acquire the student to collaborate with other students from different professions on giving health services. And lastly, professional college or field clinic done directly under the health institution, such as hospital, clinic, and community related.
Now I will continue the presentation about the advantages of IPE. In healthcare, collaborative practice is very essential because some complex patient problems can be handled by only one medical profession, but must involve multiple professions. Effective collaboration between health workers from various professions is the key to increasing the efficiency of health service and safety. According to a research conducted in 2020, there are several positive outcomes from IPE. During the IPE, first, participants can learn to collaborate and communicate between different departments. Second, IPE allows students to learn more about the role of each profession. Third one, participants learn how to solve problems together and are expected to make decisions in groups or teams of different disciplines. The fourth one, participants gain additional knowledge from other professions while undertaking IPE, and their perspective were open to think more openly about health issues. The last one, it can eliminate the selfishness of their profession and that all professions have equal roles in solving patient problems. Based on the data from World Health Organization, effective collaboration among medical professionals is necessary to provide satisfactory medical service to patients. In both acute care and primary care, patients report greater satisfaction, greater accessibility of care, and improved health outcomes after being treated by collaborative teams. Research evidence from World Health Organization has shown that collaborative education and collaborative practice can decrease total patients' complications, length of hospital stay, tension and conflict among caregivers, staff turnover, hospital admission, clinical error rates, and mortality rates. IPE can accommodate the growth of health science. It's known that health and medical science are dynamic. Health information and updates are almost every minute. Therefore, it requires health professionals who are easy to adapt to giving health service. The characteristic of a health professional who is educated through the IPE system have already accustomed to adaptation. Thus, it's effortless for them to receive the fast-changing knowledge and health.
Aside from the advantages of IPE, there are also a few instances that can prove harmful to the implementation of IPE. These limitations are divided into three. The first one is the lack of communication, which can result in the presence of a language barrier, differing communication styles, and the inability to discuss and share opinions on a subject. The second one is the lack of cohesiveness, which can result from prejudice about other professions, status and hierarchy differences, the need for power and individuals, and the competitive environment during the implementation of IPE. And the last one is the lack of support. There is a lack of faculty development courses, there are budget cuts and lack of urgency and leadership that could provide as limitations for the implementation of IPE.
Looking at the divisions from the importance of IPE, there are things that need to be improved in order to maintain an excellent quality of health services. Things that could be improved and upgraded in the implementation of IPE are, first, a wider and more intense counseling about IPE, because the term of IPE is still unpopular among students, specifically medical students and health services. The second is IPE implementation in curriculum. In order for interprofessional collaboration to run well at the professional education stage, IPE learning is needed in academic period. Next.
The third is high grading system. This method still needs to be improved in order to maintain good attitude and to improve performance among future healthcare workers. The fourth is optimization mentoring from the professionals. Academic supervision from the professionals play an important part in IPE process, while nowadays the implementation is flag added. So optimization in mentoring from the professionals should be taken as a way to improve IPE. The fifth is increasing methodological quality of studies. From the research that Scott Reeves had done, there are methodological limitations in IPE process. Increasing in methodological quality of such studies may be hopeful that the evidence of this field will increase more robust.
Interprofessional education is an essential practice that needs to be implemented in modern healthcare services. It helps improve and develop healthcare workers in this ever-changing world of information. Achieving proper results in IPE can only be obtained if the implementation is proper and adequate to the various types of healthcare students that will be receiving it. Optimization and improvement must be done regularly to further refine IPE. Students and workers as one must also acknowledge and have the will to develop further, as they are and will be the front line with which IPE is being utilized. This helps improve the overall healthcare services that can be obtained not only by our fellow Indonesian citizens, but by foreigners as well. This becomes an achievement in the goal of giving better healthcare to those in need.
And that's all for our presentation. Thank you for your attention, and we are very sorry if there's any mistake that we've done before. Thank you.